A stroke is a medical emergency where blood flow to the brain is cut off. Recognizing the signs early can save a life and prevent permanent disability. The FAST assessment is a simple tool to help you identify if someone is having a stroke. Remember, time is brain. This simple checklist can help you spot the signs immediately. Face drooping. F is for face. Ask the person to smile. Look closely at their face. Does one side droop or feel numb? Is their smile uneven? If the face looks asymmetrical, that is a warning sign. A is for arms. Ask the person to raise both arms. Does one arm drift downward? If they cannot lift one arm or it feels weak, that is another sign of a stroke. S is for speech. Ask the person to repeat a simple phrase, like, "The sky is blue." Is their speech slurred? Are they struggling to find words or sounding strange? If their speech is unusual, take note. T is for time. If you see any of these signs, even if the symptoms go away, it is time to call emergency services immediately. Do not wait. Note the time the symptoms started and get medical help right away. Remember FAST. Face, arms, speech, time. Sharing this knowledge could save a life.